In just over 1 month, a new unknown virus has gone from one city in China to infecting over 75,000 people in more than 25 nations worldwide, and now has killed the first person in Europe.
It is a grave situation.
18 million people under lockdown in China.
Emergency meeting of the World Health Organization.
Another case of coronavirus is found in the UK.
So with the COVID-19 coronavirus death toll in China now at more than 2,200, and with over 1,000 cases and 8 deaths outside of China, how worried should you be? And after weeks of scientists working around the clock to understand the virus, what should you actually do to prevent it? We're going to explore the latest key information around what we do know about the virus and what you can do about the latest global health scare. So what actually are the symptoms? People with COVID-19, as the novel coronavirus strain has now been officially named, have flu-like symptoms, so that means a cough, high temperature or shortness of breath. But because coronavirus only affects the lower respiratory system, having a sore throat is not usually a sign of the virus, although some patients have reported it too. For most patients, the symptoms have been mild. Most of those who've died in China appear to have had pre-existing health conditions and they've been elderly. Digging a little deeper, a Lancet paper from January that looked at 99 patients with the COVID-19 coronavirus found that it's more likely to affect older men with existing illnesses. Of the 99 in the study, the majority were men, the mean age was 55.5, and more than half already had chronic diseases. The fact that it may disproportionately affect older men is a similar pattern to SARS. Thus, some scientists believe that there could be a male vulnerability to coronaviruses. Regarding the death rate, the most recent estimates from Imperial College London suggest that 1% of people with coronavirus die from their infection. China has also done its own study into more than 44,000 cases, the most detailed research into COVID-19 yet. It found that more than 80% of cases were mild and put the overall death rate at 2.3%. So how does what we know so far about the novel coronavirus compare to the flu? Well, seasonal flu, which comes in the winter every year, has a death rate of around 0.1 to 0.4%. So this novel coronavirus appears to have a death rate higher than that. But pandemic flu, which is a global outbreak and which we saw happen 3 times in the 20th century, has a death rate, depending on the strain, of 1 to 3%. So this COVID-19 coronavirus appears to be similar to that. Again, that's a lower death rate than SARS, which has about a 10% death rate, and Ebola, which is around 50 to 60%.
COVID-19 is not as deadly as other coronaviruses. More than 80% of patients have mild disease and will recover.
And how is the virus confirmed? There's a test called PCR, that stands for polymerase chain reaction. It identifies the coronavirus based on its genetic fingerprint. You should only be concerned if you are displaying those symptoms and you've travelled from Wuhan in Hubei province in the last 2 weeks. And that also applies if you've been to other parts of China, as well as Thailand, Japan, South Korea, Hong Kong, Taiwan, Singapore, Malaysia and Macau. That's according to the latest guidelines from the UK government. So what's the best way of avoiding infection? We're going to have to start by talking about these, the face mask. They've sort of become the global symbol of the coronavirus. But should you actually be wearing them? And do they actually do anything? Well, the general advice is that if you're coughing and sneezing and you haven't been to any of the countries on that list, just do what you would do normally. Use a tissue and put it in a closed bin. And keep yourself away from others.
So the evidence for face masks in the general public is very limited. In fact, there's no evidence to show that they have any effect whatsoever. A number of studies have been done previously on influenza and shown that in the general population they have no impact on transmission.
Actually, the WHO says the only time you should wear one, if you're a healthy individual, is when you're taking care of someone who has the novel coronavirus. And wearing a mask isn't as easy as you might have thought. You've got to wash your hands before you put it on. You've got to make sure it covers your mouth, your nose and your chin. And you've got to make sure you don't touch it while you're wearing it. And once you've then worn it, you've got to dispose of it properly. The key thing is that the mask doesn't work just by itself. One of the best things you can do is regularly wash your hands and use a tissue when you sneeze.
Masks are of limited utility unless you're using the right type of mask in the right way and washing your hands frequently whenever you touch it. Now, if someone's unwell, to wear a mask might be beneficial because it will limit when they cough and sneeze how far the spray goes, and it will also stop them covering their mouth with their hands and then shaking hands with someone.
The WHO has declared a public emergency, but not a global pandemic. and countries have been proactive in tracing those who have been infected.
We cannot say it's a pandemic. The contacts are traceable. We know the chain of transmission, and the authorities are reporting regularly the cases, but things are under control.
Now, Egypt recently became the first country in Africa to report a case of COVID-19. Is that a cause for concern? Well, countries in Africa have been preparing for an outbreak. And even before Egypt's confirmed case, people have been quarantined in Ethiopia, Kenya, the Ivory Coast and Botswana. But there's still some concern about how some countries will fare if the coronavirus spreads, and just how far this virus could reach.
Do you think that the infection rate of 60% of the population, which has been suggested by some of your colleagues, is realistic for Britain?
Potentially. Given we know a lot about how these sort of viruses spread, we have lots of data from past epidemics. Given how transmissible this virus appears to be, and the fact that at least all adults can be infected, we have much less data in children, then 60% is a reasonable figure for the epidemic size within the first 12 months or so.
However, that claim was disputed by the WHO, who said that that would only be the case if nothing was being done to contain the spread.
Many things are done to stop the virus. The number of cases remain increased but stabilized, and so we don't see an explosive epidemic as we could have feared at the beginning of this outbreak.
Of course, one of the biggest cases of coronavirus outside of mainland China is not in a country, but on one ship. Of the more than 3,700 people on the Diamond Princess, 634 were infected with the novel coronavirus after they were all quarantined for more than 2 weeks. Now, cruise ships are used to preparing for outbreaks like this. Norovirus has been a problem before, and it's difficult to say why more cases are coming up despite the quarantine.
I think there probably needs to be an investigation once everyone's off the ship to identify what happened. Did quarantine measures fail? So was it not being implemented properly? Was there some kind of environmental source on the ship that we need to know about that helped in the transmission? Or is this really just that actually a lot of people were exposed a lot earlier than we thought, before quarantine started, and they're just showing symptoms over a gradual period of time?
So really the key to stopping the spread is being able to identify and isolate those who may have it. A lot of it comes down to how good countries are at tracing people who are coming into contact with the virus and making sure they are tested, and then dealing with them afterwards if they have the virus. So that's our latest update on the novel coronavirus. Let us know if there's anything more you'd like to know in the comments below, and subscribe to make sure you stay informed.